Hey there, good morning, Indiana. Welcome to Who's Left This Week, the only unapologetically progressive Sunday morning talk show for the Hoosier State. My name is Scott Aaron Rogers. I'm broadcasting from Bloomington. We have a great show lined up this morning. Got some newbies here joining the rotation, a couple new guests. Can't wait to introduce you to them. First, we're going to do a little bit of housekeeping. Make sure you are all subscribed over at whosleft.us. That is where you will find everything we publish. We got the podcast there. We have our backlog of these episodes, articles, all the good stuff. Again, that is whosleft.us. And hey, we have a special running over there right now. Normally $50 a year or $5 a month to become a paid member and help this project move along. But right now, I only need about $350. 30% off until the end of the year for a paid subscription. That's $350 a month or $35 a year. And hey, I get it. We got the holidays, look, my festive background, behold. And budgets are tight. I get it. So if you can't help out right now, do please subscribe on social media. The handle is at whosleft.us on Blue Sky, Instagram, and Threads. It is just at Who's Left on the others. All right, I think that covers it. Let us welcome in our guests this week, starting with our returning guest. There's our good friend, Derrick Holder. Derrick, welcome.
Hello, how are you?
Very good. Happy Hanukkah.
Thank you. Happy Hanukkah.
The last day of Hanukkah today, is that correct?
Correct.
Wow, very good. Well, I hope it has been a good one for you and your family. Let us welcome in some new folks with us today. There is actual good friend Maria Douglas, who I know from way back in the day. Her husband and I worked together, but Maria is a first-timer here on the show. Maria, welcome.
Thank you so much for having me.
Say, introduce yourself to the good folks who don't already know you.
Oh, yeah, thank you. So Maria Douglas, she, her pronouns. I'm here in Bloomington, Indiana as well. And the last time Scott Aaron Rogers and I probably saw each other was maybe in the middle of the Gulf of Mexico because a generous gift from the shared employer that he mentioned. And so I've been in Indiana for 45 years. I came to school and I've been in Bloomington for over 30 years. No one needs to do math on that. It's beautiful to see, Scott and myself in terms of our evolution, right? And how we choose to move about in the world. So I'm also co-chair of Hoosier Asian American Power. We are a statewide organization that has 3 pillars: healthy democracy, reproductive justice, and racial equity. So we work hard on voting rights, voter protection. And right now, in terms of racial equity, we're really focused on immigration.
Yeah, and we're going to get into that a little bit this week. So let us meet our final guest here. And there's a doctor in the house. That's Dr. Rob Stone.
Good morning.
Welcome.
Happy and a bright solstice to you.
Is it that day? It is.
Yeah.
Shortest day of the year. But the show, same length. Doc, introduce yourself to the good folks.
Well, I was born and raised in Evansville, and then I left Indiana for college and medical school and did most of my medical training in Denver. I graduated from medical school in 1977, so it's been quite a long time ago now. And I moved back to my home state of Indiana, to Bloomington, then in 1983. So I've been here quite a while. I never went to school here in Bloomington, but I'm quite happily settled here. And so I started practicing initially as a family practitioner in the barrio in the Hispanic West side of Denver. And then when I moved back home to Indiana, I worked as an emergency room doctor for almost 30 years, mostly in Bloomington, but also in Martinsville, Connersville, Seymour, Bedford, Jasper, a bunch of different places around the state. And then since 2012, I've changed my career path a little bit differently. And now I do hospice and palliative care. So you could think of it as end-of-life care, although that's a bit of an oversimplification for what I do. And I still work a couple days a week. So I'm not retired, even though I'm about to turn 74. And for also my whole life, I've been an organizer and an activist, originally anti-war and then anti-nuclear power, against nuclear weapons proliferation. I met my wife in Colorado protesting at the Rocky Flats nuclear bomb facility. And my big focus since 2005 has been Medicare for all, meaning we need to figure out how to take care of everybody in this country. Our healthcare system's dangerously broken, and you all know all the problems, and maybe even more than I do, you who are living in this system. But we want to figure out how to take care of everybody. So healthcare is a big issue.
It is, and really, I think we're going to see with the stories we cover this week that health touches all these issues. Really, so much of everything we talk about has to do with the public health and certainly our own mental health